Hi, everybody. Welcome. I figure we'll just give a few seconds here for everybody to get in before we get started. All right, so we're going to go ahead and get started. So, welcome. I would like to start off by letting you know that I am really glad that you're here and I look forward to spending the next 30 minutes together. My name is Dr. Leela Cleary. I am an audiologist with Blue Moth Hearing. Today is the first session of our series in tinnitus. We're going to start by grounding ourselves in knowledge, understanding what tinnitus actually is, and how the auditory system processes sound and why your brain may be generating these phantom sounds. This session is meant to empower. Today, by the end of the webinar, you'll have a clearer picture of exactly why it's happening and why you're hearing this sound. So let's get started. Tinnitus is incredibly common. Approximately 10% of United States adult population has tinnitus, which means about 25 million Americans experience some form of tinnitus. Roughly around 5 million people struggle with bothersome chronic tinnitus, while 2 million find it debilitating. Unfortunately, most of them have never talked about it because it feels personal and invisible, which is one of the reasons why we're here today. We want to bring awareness to a topic that can feel so isolating. So, what is tinnitus? Tinnitus is the perception of sound when there is no external sound present. That might be ringing, buzzing, hissing, pulsing, clicking. Everyone experiences it a little different. Tinnitus can be categorized in several different ways, and we will discuss a few of those ways together right now. One way to categorize it is as subjective and objective. Subjective tinnitus are sounds that are perceivable only to the specific individual. Subjective tinnitus is usually traceable to the auditory and neurological reactions to hearing loss, but can also be caused by an array of other catalysts, and we'll discuss some more of those later in detail. More than 99% of all reported tinnitus cases are considered subjective. Objective tinnitus are sounds that are audible to other people as well as the individual. These sounds are usually produced by an internal function in the body. So, something circulatory, which is the blood flow, or somatic, which is musculoskeletal movement. Objective tinnitus is more uncommon and it only represents about 1% of the total tinnitus cases. Another way to categorize tinnitus is as primary and secondary. Primary tinnitus accounts for the vast majority of tinnitus, so there's no clear cause of the tinnitus. Individuals diagnosed with this condition will not show any other identifiable triggers for the sounds in their ears. Most often, primary tinnitus can be associated with sensorineural hearing loss. Secondary tinnitus is more uncommon. This represents less than 1% of tinnitus cases. Secondary tinnitus is often a sign of an underlying medical condition, something auditory related. It could be earwax buildup, it could be a middle ear condition such as otosclerosis or eustachian tube dysfunction. It can be an inner ear disorder such as Meniere's disease or an auditory nerve condition including vestibular schwannomas. It can also be a non-auditory condition that can contribute to secondary tinnitus. And this includes vascular abnormalities, myoclonus, intracranial hypertension, temporomandibular joint disorder, TMJ. Pulsatile, though, is actually the most common secondary tinnitus. So, pulsatile tinnitus pulses synchronously with your heart, and it can be indicative of a vascular issue. So, because secondary tinnitus may be associated with treatable underlying conditions, individuals experiencing either pulsatile or non pulsatile secondary tinnitus should seek an evaluation from a physician with expertise in tinnitus and its related medical causes. It's really important because sometimes it can be indicative of a serious issue, so a medical evaluation is crucial. So now let's go through how we hear. How does hearing work? So here's a very simplified explanation of hearing. Sound enters the ear as vibrations. This then stimulates and vibrates the eardrum and the ossicular chain, which are those small little bones, the smallest bones in our body. And those vibrations travel into the inner ear. And we have this snail shaped organ called the cochlea. The cochlea is fluid filled and it allows the signal to be converted into an electrical impulse for our brain to process. Those impulses then travel to the brain, which is then interpreted into a meaningful sound. This means hearing is not just an ear experience. Hearing is a brain experience. The ear brings the sound in, the brain organizes it, filters it, and gives it meaning. So, where does tinnitus originate from? So, just to be clear, we're talking about subjective primary tinnitus right now. From a broad perspective, tinnitus often shows up when something changes in the auditory pathway. For example, like reduced input from the ear. When that happens, the brain tries to fill in the missing signal. It basically creates a sound internally to compensate. So, tinnitus is not random. It's actually your brain being very active and adaptive. So, let's break that down even a little bit more. So, inside of our cochlea, like how we just discussed, are these sensitive and fragile little hair cells. When those hair cells are damaged, possibly due to noise exposure or aging, they send fewer signals to the brain. So, in response to this lack of input, the central auditory system attempts to compensate by turning up the gain or activity level. This then leads to changes in our brain. One of these changes is hyperactivity in the auditory cortex. Our auditory cortex is one area of our brain that is responsible for processing sound. So, when sound input is reduced in the cochlea due to damaged hair cells, the brain compensates by increasing neural activity in the pathways, which then leads to spontaneous firing of neurons in the auditory cortex. The brain then mistakenly interprets this neural firing or static as sound. So, the next thing we're going to talk about is the neuroplasticity, which is the rewiring of the brain. So, the brain is constantly changing and reorganizing. After changes in hearing, so that lack of input, the brain may remap regions and shift neural connections, and this can lead to sound. So, let's break down what that means. Tinnitus essentially is a side effect and a result of a very predictable and oftentimes beneficial, however, in this case, not so beneficial form of neuroplasticity. And that is caused by some change in an individual's hearing, so damage to those little hair cells in the cochlea. Even for people who are considered to have normal hearing on an audiogram, they can still have a subclinical change. So, subclinical means that it's not detected on a hearing test. This is often known as a hidden hearing loss. So, you can go to an audiologist and you can have your hearing test come back normal, but that does not mean that you don't have a hearing loss in those extended frequencies or pitches, or that you don't have damage to the cochlea that isn't recorded on an audiogram. So, when this happens, when hearing loss is either detected or undetected, the brain has the ability to redistribute the energy and modify the neural activity in the hearing pathway. It is not getting the stimulation from the cochlea. So, if we think back at our picture of the ear, after that sound is changed into an electrical impulse, it is carried through the brain stem and up to the auditory cortex. And the brain modifies to compensate for the damage elsewhere. So, in this case, the cochlea, and it's compensating for the reduced and weak auditory input. So, the tinnitus arises as a side effect of that compensation. Our brains are trying to be helpful. So I wanted to make it very clear that it is a legitimate, measurable nerve signal in the pathway that stimulates the brain in a manner that is consistent with the brain being stimulated by an external sound. So what you are hearing is real. Now we are going to discuss the change that occurs in our limbic system. For most people, the limbic system involvement can be the most detrimental aspect of the tinnitus cycle. The limbic system is the area of the brain where we translate and process how things emotionally affect us. In regard to the tinnitus cycle, the extent to which the limbic system is involved has everything to do with how it's affecting the quality of our lives and how much the tinnitus affects someone on a day-to-day basis. While the damage to the auditory system generates the tinnitus signal, it is the limbic system that drives the tinnitus. The limbic system is telling the brain that the tinnitus signal is something harmful and threatening and to be on the lookout for it. Although the sound of the tinnitus, which is usually ringing or buzzing, is not in itself a threat, but the brain reacts like it is, and it causes a stress response. This is not necessarily a conscious decision. Rather, it's more of a response modulated by the limbic system. So another consideration is that sometimes tinnitus comes first and sometimes it's followed by then that stress and anxiety. And in other cases, stress and anxiety were already there and perhaps the tinnitus intensified it as a result. But either way, having bothersome tinnitus that affects you most of the day will create a high degree of stress and anxiety, which leads to a vicious cycle. The risk factors for tinnitus. So, while not everyone with hearing loss has tinnitus, many people with tinnitus have a hearing loss. In fact, it's the leading cause of tinnitus, with an estimated 9 out of 10 individuals with tinnitus also experiencing some degree of hearing loss. The reason being due to the issue we discussed previously, where there's damage in the cochlea and the hair cells, resulting in reduced input being sent to the central auditory system. Another risk factor is earwax impaction and middle ear fluid. Very similar to a hearing loss, but this is more of a temporary hearing loss. So what happens is when we have a buildup of earwax or we have middle ear fluid, which then can lead into an ear infection, these conditions cause the blockage of the sound to the ear. So it's not able to travel into the cochlea. So once again, we're getting a decreased input from the ear, which then can lead to tinnitus that is generated in the brain. Usually this type of tinnitus will resolve when the blockage is resolved. So once that earwax is out or once the middle ear fluid is resolved, then the tinnitus goes away as well. Jaw and neck issues also tend to carry a high risk of tinnitus. So disorders of the temporomandibular joint, TMJ, and the neck can cause tinnitus. So TMJ dysfunction originates with the misalignment of your jaw or grinding your teeth, which can cause inflammation and irritation of the muscles around the joint of your jaw. This can lead to or increase tinnitus because people with TMJ disorder are known to be at a higher risk for tinnitus. There's little understanding on how these disorders link so much to tinnitus, but we can assume that due to all of the strain and the tension, the inflammation and irritation can trigger the tinnitus with all the muscles surrounding the ear. But to be clear, connection is really unknown. Medical and dental treatment has been shown to ease some of these tinnitus symptoms. Medications. So tinnitus is commonly listed as a potential side effect for many medications. Some of these medications are considered ototoxic, meaning that they can cause damage to the inner ear at certain doses. While this impacts the cochlea and the hair cells, so ototoxic medications can potentially damage the cochlea and hair cells, it is clear how this can lead to tinnitus. Same thing, reduced input is going into the central auditory system. However, there are also many non-ototoxic medications that can cause tinnitus. So non-steroidal anti-inflammatory drugs may cause tinnitus or make tinnitus more prominent in higher doses. So like aspirin or ibuprofen. But tinnitus usually resolves when you stop taking the non-ototoxic medications. So while medications are not always avoidable, your provider may be able to provide alternative treatment methods. And it's very important to have these discussions with your physician prior to deciding to stop any medication to make sure that this right decision for you. Head injuries have been reported in up to 10% of individuals with tinnitus, and those whose tinnitus was related to trauma tend to have a higher rating of distress from their tinnitus. Actually, half of all traumatic brain injury cases reported injury related tinnitus. TBIs tend to be most common in people over the age of 75, and also as well as those people who served in the military or are involved in high impact sports. There are many conditions linked to tinnitus, the most common being diabetes, which correlates to the loss of hearing, elevated blood sugar, which is a symptom of diabetes, and this can cause damage to the blood vessels that eventually affect the inner ear. Cardiovascular diseases similarly can affect the blood supply to the inner ear, resulting in damage. And the last risk factor we're going to discuss is stress. So, the way that stress works in our body is that when stress occurs, our body initiates a series of physiological responses, including heightened heart rate, muscle tension, and the release of the stress hormones such as cortisol. These reactions can influence not only our body, but also our auditory system. So, stress has the potential to worsen tinnitus in several different ways. The first being increased awareness. So, stress can heighten our sensitivity to bodily sensations, including those related to tinnitus. So, the more we focus on the ringing and buzzing sounds, the more prominent they become. Muscle tension is another. So, stress leads to muscle tension, particularly in our necks and our jaws and our shoulders. And so, the tension can affect the muscles and structures around the ear, potentially worsening the tinnitus. Cortisol impact is also another way of that tinnitus, that stress having an impact on our tinnitus. So, elevated cortisol levels, which is the body's stress hormone, can negatively impact one's auditory system. Cortisol influences body flow, inflammation, nerve function, all which contribute to tinnitus. And last, we're going to talk about is sleep disruption. So, stress can interfere with sleep patterns and it leads to fatigue, reduced resilience to cope with the tinnitus symptoms. So, lack of quality sleep can amplify the perception of tinnitus. So, while this list gives many causes of tinnitus, there are certainly other things that trigger tinnitus spikes in daily life. For example, nicotine, caffeine, alcohol, high sodium intake. Those are all habits that are worth adjusting in order to determine their impact on the tinnitus. So, now let's talk about the emotional impact. Tinnitus isn't just a sound, it is a vicious cycle. It is important to understand the relationship between tinnitus and the brain to understand how tinnitus affects individuals differently. So, tinnitus affects three main parts of the brain: the auditory cortex, the autonomic nervous system, and the limbic system. These three systems work in tandem together within the brain. This will determine how severe a person perceives their tinnitus symptoms. So, let's start with the auditory cortex. We have discussed this previously. The auditory cortex is located within the temporal lobe of the brain, which sits behind the ears. It is responsible for receiving the auditory signals. So, hyperactivity, which we talked about, along that auditory nerve fiber, as these neurons search for the missing auditory input from the damaged cochlear hair cells. This hyperactivity leads to the brain mistakenly processing sounds that do not exist in the external environment, creating tinnitus. The autonomic nervous system is responsible for the awareness of new things in our environment. This system helps us to be able to label these new things as either good, bad, or neutral. So the system is responsible for our fight or flight reflex, which is that reaction that occurs when the body perceives something stressful, threatening, or harmful. So during the fight or flight response, our senses become heightened. And for 20% of patients who report severe tinnitus symptoms, their autonomic nervous system is likely in a state of flight or fight. And when your body is searching for stimulus in the environment to figure out what is going on. And the last one is once again that limbic system. So the limbic system is the emotional part of the brain. The limbic system is the area of the brain that processes emotional response. Many studies show that tinnitus patients often suffer from feelings of depression and anxiety as it relates to their tinnitus. This is likely moderated through the limbic system, as the limbic system tells the brain that the signals it's receiving from the tinnitus are harmful and threatening. So, to summarize, it's very clear that there is a very close link between tinnitus and our brain's automatic reaction to tinnitus. So, right now, when you notice your tinnitus, it makes you feel stressed, anxious, hopeless, irritated, annoyed. And because it makes you feel bad, your brain sees the sound as a threat. So, to protect you from that threat, your brain needs to keep checking to see if the threat is there. So, whenever you check for the tinnitus, you think about it, you become aware of it, you hear it, and then it makes you feel bad again. So, tinnitus goes beyond a sound that is heard. It impacts sleep, concentration, mood, quality of life, and can create a sense of helplessness. Many people have dismissed tinnitus or have been told there's nothing you can do, and that feeling is so deflating. If this has been your journey, I want you to hear this. Your experience matters. Your frustration is valid, and you don't have to navigate this alone. With guidance, structure, and the right support, your brain can rebuild a sense of safety and peace again. So, why is tinnitus more noticeable in silence? Many people notice that their tinnitus seems to be louder in quiet environments or at night. But why does this happen? It all comes down to how our brain processes sound. During the day, our brains are constantly receiving input from the environment. So, traffic, conversations, music, even the hum of the refrigerator. These background sounds partially mask tinnitus, making it less noticeable. But when things are quiet, like when you're laying in bed at night and there's less external sounds to compete with the tinnitus, the phantom sound suddenly stands out. The central auditory system plays a big role in this because tinnitus arises from changes in the brain caused by hearing loss or other triggers. So, in quiet settings, the brain is more alert to subtle signals and it naturally amplifies whatever is there, including the tinnitus. Attention also matters. So at night, when the environment is quiet and our minds are less distracted, we tend to notice subtle sensations more. So focusing on tinnitus makes it feel louder, and the emotional response, frustration, stress, anxiety, can amplify it even further. And this is part of that vicious cycle that many people experience. And finally, fatigue and lack of sleep can heighten perception of tinnitus. When the brain is tired, it may have less ability to tune out the tinnitus and making the sound more noticeable. Tinnitus isn't the same for everyone. It can vary in pitch, loudness, or how we even notice it. The differences come from where in the auditory system the changes are occurring and how the brain is adapting to them. So, for example, damage in the high frequency or high pitch regions of the cochlea may create a high pitched ringing, while other areas might produce a lower tone. Tinnitus can fluctuate depending on factors like stress and fatigue and being in a quiet environment. So, if you take two people with a similar hearing loss, they may experience tinnitus completely different, which shows how individualized the brain's response can be. And it's very much particular to an individual person. Myth versus reality. So, as many of you know, the tinnitus world is flooded with quick fixes, and many of them are aimed at people who are overwhelmed and just want the noise to stop. It is easy to get pulled towards supplements and eardrops and gadgets and miracle ear promises. But these products focus on symptoms, not science. They don't address the brain changes that actually drive the tinnitus, and they often leave people feeling more discouraged after spending money and getting no real relief. Tinnitus is one of the most misunderstood conditions, and it can be profoundly isolating. Most loved ones don't realize the invisible weight that is carried or the expectation to look and act normal on the outside when struggling internally. That disconnect can be exhausting emotionally, mentally, and physically. But here's the part that most people never hear: tinnitus is not a hopeless condition. The brain is adaptable. And with the right guidance, it can learn to reduce the loudness, urgency, and emotional pull of the sound. Relief does not have to come from the quick fix. It comes from understanding what is happening in your auditory system and giving your brain the support it needs to settle. Progress is absolutely possible, and many people experience a noticeable shift when they're finally given the right tools. There is hope. So I want to thank you for joining our Blue Moth community today with this webinar. Today was all about understanding. Our next webinar is about empowerment. So our next session is going to be focused on what actually helps: sound therapy, cognitive behavioral therapy, acoustic stimulation, practical coping strategies. So please join us on December 16th for part 2 of our tinnitus series. If you would like a complimentary consultation to discuss your tinnitus journey and personalized strategy, please feel free to give us a call. Our number is 855-496-2766. You will receive an email after after the webinar with our booking link as well as our phone number in case you didn't catch it. So please also know that we are currently offering $50 off of our cognitive behavioral program for tinnitus for those who have attended the webinar. So you will be sent that promo code in the email as well. We are here to educate and give you the tools that help your brain calm the noise. And once again, thank you so much for joining me, and I hope I get to see you next time. Thank you.